Hello, everyone. My name is Nida, and today we are here at the episode of Persivia Perspective, and we are going to be talking about AI and Gartner's new report on top technologies. Today, we have Dr. Usama Bajwa here with us, who is going to be our guest and who is going to be talking about AI. He happens to be the engineering manager at Persivia for AI. Dr. Osama, my opening question to you is that, in your view, why do provider organizations require different AI or LLM use cases across various areas of healthcare? And how should they approach when selecting the right solutions for their specific needs?
Okay, thank you very much, Nida, for the invitation. Regarding your question, it is because of diverse operational needs. So, like healthcare has multiple domains ranging from clinical diagnostics, patient engagement, administrative workflows, and research. And each of them required a tailored AI LLM solution. But now these generalizable AI models are evolving. So the large language AI models, for example, GPT-4 or MedFarm, are actually improving, which reduce the need for multiple specialized models. But having said that, there are other factors like regulatory and compliance considerations. For example, we have different departments ranging from radiology to billing, and all of them have distinct regulatory constraints. So a one-size-fits-all AI model may not actually ensure compliance across all these areas. Another issue could be the data variability and the privacy. So the clinical records, the patient records, and the operational data, they vary in structure and sensitivity, which demand a specialized AI model for each different use case. Thirdly, the efficiency and the return on investment. For that, the AI adoption should be aligned with specific goals. So either they are going to reduce the physician burnout or improving patient outcomes or streamlining the billings to ensure meaningful impact. And lastly, there are interoperability challenges like healthcare ID systems, including EHRs, PACS, IoT-enabled devices. They have diverse architectures, which require AI solutions that can integrate seamlessly. The second part of the question was how healthcare organizations should actually select the AI LLM solutions. That may depend on four conditions. First of them is the need assessment. By need assessment, we mean prioritizing AI use cases based on clinical operational bottlenecks, for example, diagnostics accuracy or administrative automation. The second thing could be the scalability and integration. So, which means choosing AI solutions that can actually integrate with existing EHR systems, imaging tools, or telehealth platforms without any heavy infrastructure changes. Thirdly, are the ethical and regulatory compliance. So one has to ensure that the AI aligns with the HIPAA Act and the local healthcare regulations to protect patient data. And lastly, it is about the continuous monitoring and feedback loops. So the AI models should actually undergo real-world validations and a periodic retraining to avoid performance degradation.
Thank you so much, sir. So my the next question is actually related to this. Then, when selecting an AI vendor, transparency, data security, and patient safety are some of the critical concerns. What are the three factors that provider organizations should prioritize to ensure trust and compliance in their AI partnerships?
So, regarding the 3 points, the first one could be the regulatory compliance and ethical AI governance, as I just explained in the previous question. This matters because the AI vendors, they must adhere to healthcare regulations like HIPAA and the local data protection laws to safeguard patient information. So the AI vendors that lack regulatory certifications, they may expose providers to legal and financial risks. Second important thing is the bias mitigation, explainability, and fairness. This must be embedded in the AI models to prevent biased clinical outcomes. So the black box AI models without any explainability can lead to clinical misinterpretations. The second important thing is about the data security, privacy, and the interoperability. So this thing matters because the AI models trained on sensitive patient data must have an end-to-end encryption, a robust access control, and data anonymization. All these to prevent breaches. So vendors without proper cybersecurity measures can actually expose patient data to ransom attacks. And the interoperability with the EHRs, PACS, and telemedicine platforms that ensures seamless integration into healthcare workflows without major infrastructure overhauls. So the proprietary AI models that don't integrate with existing hospital IT systems can actually lead to workflow inefficiencies and data silos. And the third can be the model performance, its accuracy, and its validation on real world data. And that is important because the AI in healthcare that must be clinically validated on diverse datasets to ensure accuracy across populations. So AI models trained on biased or small datasets, they may actually fail in real world scenarios, which will lead to misdiagnosis or incorrect treatment recommendations. So the vendors should provide transparent model performance metrics, for example, false positives, false negatives, sensitivity, specificity before the deployment. And the AI models should actually support continuous learning and updates based on real world feedback and the evolving medical standards. So lack of ongoing monitoring may cause the AI solutions to degrade over time, which may reduce in clinical effectiveness.
Thank you so much, sir. So now let's talk about what some of the analysts have said. In this report, they have some analysts have spoken about the top technology trends for healthcare provider CIOs in 2025 and how healthcare CIOs may face fiscal constraints and regulatory uncertainty while navigating technology trends. One of the analysts in this report, who is called Jeff Cripps, has stated that generative AI will be the most impactful in reducing clinician burnout and improving workflow automation. So, do you agree with this statement, or do you think that other forms of AI will play an equally significant role in shaping healthcare innovation?
I mostly agree because of the fact that the Gen AI, generative AI, can actually automate tasks like clinical documentation, summarization of patient history, and prescribing physician notes, which may free up time for direct patient care. And as well as the AI-powered chatbots and virtual assistants can help clinicians process vast medical literature and suggest different diagnoses, which may reduce cognitive fatigue. So, as well as the AI-driven systems can streamline the insurance workflows, reducing the administrative burden on the providers. Similarly, the AI-generated summaries can actually provide personalized patient education materials, which may reduce the time clinicians spend on repetitive explanations for their patients. Gen AI can also assist in predictive analysis for hospital resource management, optimizing staffing and supply chain needs. Having said that, generative AI will undoubtedly transform healthcare administration and clinician workforce, but other AI subfields like predictive analytics, medical imaging artificial intelligence, and cybersecurity artificial intelligence will be equally significant. Because the future of healthcare AI should not be singularly focused on Gen AI, the generative AI, but rather it should embrace a multifaceted AI strategy.
So that was a very interesting analysis, sir. But I wanted to know that is predictive AI going to be more popular than Gen AI, or do you think that they're going to be equally important then?
It will be equally important because we cannot solve all the problems with Gen AI, especially when we have, for example, we have lesser data to play with. Simple machine learning algorithms, which help us in predictive analysis, are way more important than Gen AI because bigger the models, they are more data hungry. They need more data to be trained on.
Okay. Very interesting. Thank you. So, another analyst, Veronica Walk, has stated that integrating virtual care with EHRs is essential for reducing geographic barriers and enhancing patient engagement. Virtual care is often seen as a key driver for health equity, but are EHRs truly ready to support comprehensive virtual care models on their own? Or is it going to be more effective for provider organizations to integrate third-party solutions like Persivia for a more seamless and scalable approach? What do you think is the best model in this case?
Well, integrating virtual care with electronic health records is indeed essential for reducing the geographic barriers and enhancing patient engagement, as Veronica mentioned. However, the readiness of EHRs to support comprehensive virtual care model varies, and the decision between relying solely on EHR capabilities versus integrating it with third-party solutions, like for example Persivia, that depends on several factors. Like many EHR systems have developed modules to support virtual care, including features like video consultations and remote patient monitoring. For example, there are platforms like Meditech. They offer virtual
Hmm.
care solutions that enable patients to stay connected to their care providers via convenient video visits. Despite advancements, not all EHRs seamlessly integrate with various virtual care tools, which actually leads to potential workflow inefficiency and data silos. Some EHRs they may lack the scalability required to handle extensive virtual care programs, especially when dealing with large patient populations. And advanced functionalities such as AI-driven care management, predictive analytics, and comprehensive telehealth capabilities might be limited or absent in standard EHR offerings. And when we talk about integrating third-party solutions like Persivia, it results in benefits. For example, Persivia's platform is an integrated AI-driven solution that delivers a single longitudinal record to support data, care, quality, cost, risk initiatives with bidirectional connectivity into all the EHRs. So, by integrating with existing EHR systems, Persivia ensures minimal disruption to the existing operational workflows while enhancing the virtual care capabilities. So, the platform offers advanced cost and utilization analytics, resource prioritization, and AI-generated next best actions, which are actually crucial for effective care management. So, the third-party solutions provide advanced features that may not be available in standard EHRs, which ultimately ensures comprehensive support for virtual care.
Thank you so much, sir, for answering this. So, another analyst, Barry, has highlighted that by 2030, 40% of clinical patient data will be collected through ambient intelligence using technologies like automated medical devices and computer vision. Additionally, by 2028, 50% of healthcare workforce management platforms will incorporate demand management and real time recruiting to address increased patient demand and staffing shortages. With this rise of ambient intelligence, how will data collection become more seamless, and how is Persevia leveraging this technology to build a longitudinal patient record?
Barry's projection actually underscores a transformative shift in healthcare data collection and workforce management. And the ambient intelligence actually refers to environments which are equipped with embedded technology that can sense, respond, and adapt to human presence and activities. For example, devices that monitor uh, patient vitals in real time, transmitting and transmit data in real time directly to the EHRs without manual input. So the systems that analyze visual data to monitor patient movements or detect anomalies or assist in diagnostics and wearable devices and sensors, they
Hmm.
continuously collect health metrics, which provides a comprehensive view of a patient's conditions. So these technologies actually facilitate a continuous passive data collection, which reduce the need for manual documentation and allow healthcare providers to access real-time comprehensive patient information. So in that case, Persivia's platform exemplifies the application of ambient intelligence in healthcare. It actually aggregates diverse data sources, including the clinical records, claims, health information exchanges, patient reported outcomes, and social determinants of health, which ultimately constructs a dynamic longitudinal patient record. So, powered by its AI engine, the platform evaluates each data point, aligning with goals to improve the care and the organizational efficiency. And the providers benefit from real-time data analysis, risk stratification, and the detection of high-quality evidence-based alerts, care gaps, and coding opportunities. So the care plans can be generated and tracked across a large population and different care teams, which actually enables the bidirectional communication with patients and their care teams. So, in a nutshell, Persevia actually enables seamless data collection and integration, which enhances patient care through its comprehensive real-time insights.
So, sir, you said that this data is collected. So, once this data is available, how much can the patients be effectively recruited into different care programs, and what criteria should be used to segment them?
Okay, so once this comprehensive patient data is available through the ambient intelligence which we were discussing, and then if it is integrated into platforms like Persivia's CareSpace, the healthcare providers can efficiently recruit patients into specialized care programs, and the process of recruitment and segmentation actually relies on data-driven decision making to enhance patient outcomes, to improve resource allocation, and streamline the care delivery. Since Persivia has been in this field since 16 plus years, and based on the experience, to ensure seamless patient enrollment in appropriate care programs, the healthcare providers can have AI-driven platform which can analyze real-time patient data to identify individuals who may benefit from chronic care management, remote patient monitoring, or preventive health programs. So the physicians can receive alerts regarding patients with care gaps and recommend them for enrollment based on risk justification insights. The multi-channel communication, like the SMS, email, or the telehealth, actually helps educate patients about available programs and encourages their participation. Understanding social factors affecting health, like income, education, access to transportation, etc., helps in targeted recruitment efforts for at-risk population. So, coming to patient segmentation, it's the key to deliver personalized, effective healthcare interventions. So,
Hmm.
segmentation criteria may include clinical criteria such as chronic disease status, which means patients with conditions like diabetes, hypertension, COPD, or heart disease, they can be grouped for chronic disease management programs. Another clinical criteria can be risk certification scores, where the AI-powered platform assesses the risk based on lab results and medical history to classify patients into different categories like low, medium, and high risk categories. Another criteria could be the hospitalization and this readmission risk. So those with frequent hospital visits can be placed in post-discharge or transitional care programs. Other than the clinical criteria, there is another criteria which is behavioral and lifestyle factors, in which the wearable devices data actually can classify patients into wellness, weight management, fitness coaching programs, or patients with high stress, anxiety, or depression scores can be guided towards behavioral health programs. Last but not least is the criteria based on social determinants of health, using which patients from low income backgrounds may qualify for community health initiatives and financial systems programs. And those in rural or underserved areas can be directed to virtual care or telemedicine services. So, Persivia's platform ensures seamless data integration and segmentation by aggregating all these clinical, behavioral, and social health data to create dynamic patient profiles. And then the platform uses the AI engine to identify the high risk patients in real time, and it provides actionable insights to healthcare providers, which by allowing precise patient enrollment into appropriate programs, and it also supports the bidirectional communication, which ultimately enables continuous engagement with the patients through these digital health tools.
Thank you so much, sir. That was again very informative. But linking this question to the one I'm about to say, so given the challenges of rising risk patient management, then how can a system like Persivia help mitigate these risks that you've mentioned, and while optimizing workforce efficiency?
Okay, by rising risk patients, we mean the patients, those who are not yet high risk but are trending towards a chronic or acute condition. So,
Yes.
which is a significant challenge in healthcare. So,
Hmm.
the Persivia's AI-powered platform plays a crucial role in early risk identification, proactive intervention, and workforce optimization to address these challenges effectively. And this is done by automated care pathways, which are recommendations for personalized care plans to ensure early interventions. Regarding optimizing workflow efficiency, the system assists via task automation, as the system automates routine tasks such as the follow-ups, data entry, appointment scheduling, which actually reduces the clinician's workload. So the clinical decision support alerts provide actionable insights to healthcare providers, which ultimately helps them prioritize the patients who need immediate attention. And the most important part is enhanced care coordination and communication. As being a uniform data platform, Persivia's platform provides seamless integration with EHRs, which ensures real-time data sharing across care teams. And another important feature is the compliance and cost containment uh, in reduced hospital readmissions, as the proactive care reduces unnecessary emergency visits and hospital stays. So another factor is Persivia's value-based care alignment helps healthcare organizations meet the quality metrics and the financial incentives under the value-based contracts. And finally, platforms AI-driven risk certification or care management automation or real-time data integration, it significantly optimizes workforce efficiency by automating the manual workload or prioritizing high-risk patients or streamlining the care coordination. So, as a whole, Persivia enables clinicians to focus on delivering high-quality care while reducing their operational inefficiencies.
That was very insightful. Thank you. So, moving on to what Greg has said, he predicts that by 2027, the average daily data collected from inpatient rooms will surpass that of ICU beds today. With this massive increase in data volume, how can hospitals efficiently manage, process, and utilize it? And how can AI differentiate between clean and dirty data to ensure accuracy and reliability? Lastly, what do you think, which of these AI technologies will be the most effective in simplifying this data management challenge?
Okay, to manage the surge in inpatient data, efficient data management and processing in hospitals is directly needed. So the hospitals must deploy advanced AI-driven data management strategies to do multiple tasks like real-time data ingestion coming from multiple sources, either they are EHRs, wearables, IoT medical devices. The second thing is automated filtering and prioritization to actually reduce the clinicians' overload. And thirdly is the edge computing and cloud-based AI to process data efficiently and ensure scalability. So the key solutions may include federated learning, which is about decentralized AI models that actually learn from data across multiple hospitals without sharing raw patient information. Secondly, the AI-enabled data lakes, which are unified data platforms, and they can integrate structured and unstructured data. By structured data, I mean the lab results. By unstructured data, I mean the clinical notes. They can be integrated for real-time insights. And lastly, the predictive analytics and digital twins, they can be used by simulating patient conditions to preemptively manage health risks. The second part of the question was how AI differentiates clean versus dirty data for accuracy and reliability. So the AI relies on advanced data governance and machine learning models to distinguish between clean and dirty data. So by clean data, we mean an accurate data, a complete data, a timely data, which is useful for clinical decision making. And by dirty data, we mean the inconsistent, redundant, or incomplete kind of data. So that is actually flagged for correction or even exclusion. So technologies that enhance data accuracy are machine learning processing, which actually extracts structured insights from messy physician notes. And then we have anomaly detection models, which identify outliers or inconsistencies in medical records. And then we have automated data pipelines, data validation pipelines, in which the AI algorithms compare incoming data against historical trends to flag any kind of errors. And the third part of the question was which AI technologies for simplifying data management. So to streamline the overwhelming data influx, we can leverage generative AI, which can actually automate clinical documentation, ultimately reducing the administrative burden. Secondly, computer vision and wearable artificial intelligence, which can actually enhance real-time patient monitoring. And thirdly, we have the machine learning models, which can actually predict patient deterioration based on historical data. And lastly, we have the edge artificial intelligence and the Internet of Things integration, which can actually process real-time bedside data to reduce the latency and ensure fast decision making.
Thank you so much, sir, for being a part of this podcast today. And this was really insightful. Hope to see you next time as well.
Thank you very much for the invitation. Thank you.